Approximately 1 to 800 infants are born with Down syndrome in Kenya. Down syndrome is a condition whereby an infant is born with an extra chromosome. This manifests itself in terms of defects such as mental retardedness. Therefore, it is important for us to create awareness in order to stop the stigma that is associated with Down syndrome. And that is going to be our focus today on Focus on Health. My name is Bori Michelle. You can follow this conversation on our social media platforms at KUTV Focus on Health and also on Facebook and Health Focus on Instagram. Before we see Dr. James from Kenyatta University on that, here now is the health update. That was a very informative health update, and with me on set is Dr. James from Kenyatta University, and we are going to be talking about Down syndrome. You can follow this conversation on our social media platforms at KUTV Focus on Health on Facebook and also on YouTube, and Health Focus on Instagram. Thank you so much, Dr. Ari, for joining us today. It's a pleasure.
Thank you.
So, Dr. Ari, even before we head down to our topic today, kindly introduce yourself to our viewers.
Yeah, thank you. My name is James Ndambuki, a lecturer at the School of Nursing, with a special interest in pediatric nursing.
Okay. Thank you so much, Dr. Ari. So maybe now we could head down to our topic today, which is Down syndrome. I'm sure maybe there are a couple of viewers watching and maybe they know it, but they wouldn't know it with the term Down syndrome. So maybe now you could define it to us.
Down syndrome is a genetic disorder which is basically caused by abnormal cell division just immediately after fertilization. There's usually first division of cells that takes place, and you may find that there is a problem with that division, which results in extra genetic material being inserted in some of the cells.
Okay.
Yes.
Okay, Dr. Ari, would you maybe expound maybe more on the causes of the Down syndrome for us?
The causes of Down syndrome, it's not really known what causes the addition of the extra chromosome, which basically is the one which eventually results in the characteristics that will be evident in those patients who suffer from the disease. But there are risk factors. Yes.
Dr. Ari, how many chromosomes maybe should we have? I think that you said there's an additional one.
Okay.
Maybe you could explain it to
us. Normally, the normal human cell has 46 chromosomes. Inherited 23 inherited from the mother and 23 from the father. So the chromosomes are supposed to be 46 in total. But in this case of Down syndrome, you have an extra chromosome, so it makes it 47.
Mm-hmm.
Yes.
Dr. Ari, how does that come about? I think it's a very interesting process because if one person has 23, the other one has 23, yes. How does it now become 47?
Okay, basically what I began by saying is that it's abnormal event, mm-hmm. which results in an extra chromosome during the cell division. So we do not exactly know what really causes it.
Okay.
Yeah, but there are risk factors to it, as I've alluded to.
Okay.
Yes.
Do we have maybe signs and symptoms of Down syndrome?
Yes. Basically, what happens is because of that extra chromosome, you find that the babies develop some specific characteristics, which would basically be looking for, mm-hmm. Being as the signs and the symptoms that are apparent in these babies. So basically, they will present with mental retardation. It's a common thing. The babies again will present with a flat face. They will have low set ears. They will have slanted eyes. When you look at their ears, they are small, and the head is also small. And if you look at their palm, the palm of the hand, you find that instead of having 2 creases, they will usually have 1. So basically, when you identify those characteristics, then you can carry out some tests that confirm that the patient or the baby has extra chromosome in their cell.
So, Doctor, now that you've talked about the signs and symptoms, and you can tell that most of them you can see them maybe when the child is born, can you actually tell if the child is going to maybe be born with Down syndrome from maybe a checkup?
Yes and no. Basically, we have some tests that can be carried out when during pregnancy, but they are not very specific. The test will tell you that probably the child has an abnormality, but they are not very specific until the child is born that we are able now to tell from the physical characteristics that the patient presents with that they have the Down syndrome.
Okay.
Yes.
Maybe now, Doctor, you could take us through the risk factors that now put the baby prone to contracting Down syndrome.
Maybe before I go to that, we could talk about the types.
Okay.
There are basically 3 types of the abnormality in terms of the cell division. So you will have about 95% of these patients. During the cell division, you have the addition of the extra chromosome. Sometimes, and we normally refer to that as that's like the classic form of the Down syndrome. Then we have sometimes you may have some of the chromosomes having you have the 46 in number, but some of the chromosomes have extra genetic material, and we normally refer to that as mosaic. And then we have the last one, which is translocation, where you have a piece of a chromosome getting translocated and being placed in a piece of the chromosome being transferred to one of the other chromosomes. There is a specific chromosome that is involved in this, and that is chromosome number 21. So it is basically the chromosome number 21 which usually has the problem. About the risk factors, the major one is the age of the mother. We've seen that from studies that have been done, it's been shown that with increase in age, you tend to get that the mothers may give birth to babies who have Down syndrome. And especially if a mother is above 35 years, they tend to get babies who have Down syndrome. Yes.
Okay. Doctor, what about fathers? I mean, it does not work if the father is too old.
To a small extent, there could be inheritance. And as I've said, there are different types from the different types of Down syndrome, the translocation bit only contributes about 3 to 4% of the babies who present with Down syndrome. And that is the only one which can be passed from generation to generation.
Okay.
Now, most of the babies, about 95%, it cannot be passed from generation to generation.
Okay.
So the father may not play a big role because it's only about 3 to 4% which can be passed from generation to generation.
Okay.
Yes.
And Doctor, are there things that maybe a pregnant mother should avoid that would now maybe be a danger to the infant?
Not really. Not really. It's just about the age. Remember, we are talking about cell division here. So not much. The only thing maybe that can help is normally these mothers, pregnant mothers, are given a drug we call folic acid. It may help in the development of that child who has Down syndrome, because basically there is an element of the nervous system that is involved, especially because of the mental retardation that is usually found in these Down syndrome babies. So maybe the taking of the folic acid may help in reducing now the severity of the mental retardation.
Okay.
Yes.
Maybe now, Daktari, we could talk about the complications that are associated with Down syndrome, because I can imagine it would be also hard on the mother raising the kid, and also the kid, like you talked about mental retardation, maybe as they interact with people in school or even just their social life.
Yeah, these babies experience some challenges, especially dependent on how severe the problem is. And there are complications that are associated with Down syndrome. Most of these children will present with problems with the heart, what we refer to as congenital abnormalities.
Yeah.
That is conditions where you find the heart has 4 chambers, and in between, you have the chambers, you have 2 on the right and 2 on the left. And there is a septum that separates these chambers. There is a division between the right and the left. So sometimes you may find that there are openings in those chambers, and that basically affects the flow of blood. At the same time, you will find that they experience some gastrointestinal problems. For example, you may have, there is a part in the gastrointestinal system we refer to as the duodenum. It may not develop in these babies. So some of the babies will present with problems of passing stool, which can actually be corrected through surgery. Both of them, both the congenital anomalies of the heart and the GIT, the gastrointestinal system, can be corrected surgically. So most of the complications actually can be dealt with, but the mental retardation requires a bit of rehabilitation. There's mental retardation, and when we talk about mental retardation, we are talking about thinking, we are talking about language. So speech is a problem, but there are facilities that will provide support to these children so that they can learn the skills, both the fine and the gross motor skills.
Okay.
Yeah.
That's actually very informative, Daktari. So maybe we could pick it up from there right after the break.
Yeah.
We're going to take a slight commercial break. When you come back, Daktari is going to be telling us more about Down syndrome, the diagnosis, treatment, and also whether we can prevent it. Do not move a muscle. I will leave you with the Did You Know segment. You can follow our conversation on our social media platforms at KUTV Focus on Health on Facebook and also on YouTube, and Health Focus on Instagram.